Hello, dear Australian Epitherapy Association conference participants. I would like to present our research treating horses with bronchitis using propolis and honey. So, a little bit about myself. I am a veterinarian from 2005. And also I'm a horse anesthesiologist, work at large animal clinic in Lithuanian University of Health Science in Lithuania country. So my specialization is horse internal diseases, hematology and toxicology. Also I'm research and work with horses and other special animals. So, speak about propolis. What is propolis? I think you know that bee products have been used since ancient times to treat many diseases, and including respiratory also system and respiratory elements. Clinically, propolis has shown antioxidative actions in humans, blood parameters, and also respiratory parameters, and especially in asthmatic patients. So, propolis and its components have antibacterial, anti-inflammatory, and also immunomodulatory, mucolytic, and intra-tumor activities. And also, it's not only use propolis, but in medical use, use honey, propolis, bee breed, milk, venom, and so all. But in veterinary medicine, they use a limited and very useful of Hanukkah honey partages, and also sometimes using laminitis, and especially honey used to treat wounds. So you can see our one of patients, and it was treated by using of honey. With our colleague, we decided to use propolis and inhalation and honey to treat horse bronchitis. Next to laminitis, bronchitis or pneumonia is the most common disease for horses. Symptoms need to be noticed very quickly so that a vet can give medicine preventing a chronic situation of a respiratory disease. If the vet does not, it can cause a dramatic state of health, and in worst cases ends in the recurrent airway obstruction. The first symptoms for the inflammation is the cough. At first, a horse can only have it from time to time. That makes it really hard to notice. In the course of inflammation, the cough becomes worse, and additionally, the horse has a high temperature and a worrying health. In this situation, the horse can even have a temperature about 40 degrees. Normally, the horse has temperature about 57.5. So the temperature increase, also the coughing increase, and you can see a mucus or purulence discharge of the nostrils. And also sometimes bronchitis ends in pneumonia if the horse owner did not notice the symptoms in time. So the type of inflammation in bronchoalveolar fluids will dictate the therapeutic plan, and regardless of the cytologic profile, all horses with bronchitis should receive aerosolic bronchodilator therapy before exercises and after exercises, also treated with using the antibiotics, and sometimes we use non-inflammatory drugs. And we decided to change to use propolis and honey, so to change antibiotic to plants. Yes, and like present one case, but in our research we used 5 horses. We do 2 exams. In one research we use ethanolic propolis, and in other we use water propolis. So now I present propolis, ethanol propolis. This is a male Estonian riding horse, 50 years old, and the mare has abdominal increased respiratory rate and also nasal discharge after 15 minutes after walk. So you can see the horse and how she breathes. It's a terrible breath, yes, and bronchitis. What we do in every horses we do general clinical examination. It means heart rate, respiratory rate, temperature, animal appearance. Also we do bronchoscopy. During bronchoscopy we collection arterial lavage and examinate microbiology and cytology examination with tracheal, and also we give propolis, tincture, ethanol propolis, and after our treatment 7 days we repeat our study, repeat the bronchoscopy. The blood collection was in EDTA, and also we collect blood parameters. So the treatment was 7 days. You see how we do inhalation and anesthesia, yes, and what our treatment scheme. Crude propolis was grounded and extracted with 70% of ethanol for 3 days by shaking at room temperature, and when after bronchoscopy we count and 1.4 milliliter of ethanol extract of propolis plus 3.5 milliliters of honey for 500 kilograms by weight of a horse. We mix it with 1 glasses of 50 degrees of water, and horses were inhaled 3 times a day using horse inhalation. After inhalation for horses mixing 40 milliliters of water mixed with 10 milliliters of ethanol extract of propolis and 5 milliliters of honey, and we given per horse also 3 times a day for 7 days. The second bronchoscopy and tracheal aspiration collections for the bacteriology and cytology test we repeated after treatment a week for all patients, including blood hematology and blood biochemistry test. So what you can see in a bronchoscopy before inhalation and after, it was very interesting because before inhalation you see about 3.3 scoring mucose accumulation, and after it was decreased until 1.5, 1.7 score. It was very interesting and helpful. Without antibiotic we have liquid mucus. So what about tracheal wash aspirate? We're culturing bacterial colonies, and before we were growing aspergillus, bacillus, and penicillium, enterobacteria, streptococcus, and after that we saw know that and what we see after treatment, we count the numbers of colonies before and after treatment. Before treatment, before using of propolis per ounce and inhalation, the colonies average was about 200 colonies, and after that was decreased until 40 colonies. So it was very great results, and we see the mucosal accumulation in the trachea was also a liquid field and was decreased, and about bacteria from the tracheal aspirate we calculate also didn't culture aspergillus and bacillus, and also didn't culture penicillium bacterial colonies. So our conclusion is that the Mayor's breathing also stabilized after even 4 days, was decreased heart rate and respiratory rate, also cough is disappearing, and we saw also antibacterial actions in horse with chronic bronchitis, and mucolytic actions in the lower respiratory tract in horse with chronic bronchitis. So also we saw some decreasing parameters in a blood test, like white blood cells, total proteins, and during the treatment and using propolis and honey, we collecting lactate and glucose, and lactate and glucose during and after the treatment were normal parameters. So it was very great result, and maybe sometimes we can use propolis and honey to treat horse bronchitis. And I would like to thank for my professor mentors, Professor Sonata Trumbetskaite and also Professor Audrus Kučinskas, and thank you for your attention. Thank you for inviting and be in this conference.